everyone, in the previous part we have seen the placental abnormality, and in this part we are going to talk about the cord abnormality. And before that we have the nursing lecture app for you, and the link of this app is given in the description box of this video here. And please download this app because we have many attractive features in this app, and one of them is the premium chat that is free for you. So you can ask your queries anytime to me directly. So let's come to this lecture. What are the cord abnormalities? These cord abnormalities are very common in comparison to the placental abnormalities. So here in this lecture we are going to discuss about the cord abnormalities on the basis of the cord insertion and the number of vessels as well as the length of cord. So we have the anomaly regarding the insertion of cord. So on the basis of insertion of cord there are the two varieties. So let's come on the figure here. What is the normal insertion of cord? Normally cord is inserted from the chorionic plate. Normally cord is inserted from the chorionic plate near the center or from the center, or you can say the fetal surface. So cord is inserting from the fetal surface at the center. But in the insertion of cord anomaly there is two varieties. One is the battledore placenta, and in this battledore anomaly what is happening? The cord is inserted from the margin of the placenta. So cord is inserting from the margin of the placenta like a bat. So what is happening in the bat? The handle is inserting from the edge. So like this here, the cord is also inserting from the edge of the placenta. So here is the edge. So battledore placenta means the cord is inserting from the edge of the placenta, not from the center or near the center. So this type of placenta does not cause any harm to the fetus if it is situated on the upper segment or it is lying on the superior aspect of the uterine cavity. But if it is situated on the lower segment, that may cause the fetal anoxia. Why? Because this cord may be compressed by the fetal parts. So as this become compressed, that will causes the decreased blood supply to the fetus, and that may lead to the fetal anoxia. Otherwise this type of abnormality doesn't cause any harm to the fetus. So that is called the battledore placenta. That is the abnormality regarding the insertion of cord. The second variety is the velamentous insertion of cord. Velamentous insertion of cord. So what is happening in this condition? Here it is the placenta. Cord is not inserting from this chorionic plate or the fetal surface, whereas the cord is inserted through the membranes. So cord is at a distance and the vessels are radiating from this cord, goes up to this chorionic plate and radiate themselves here. Like this. So here are the vessels which are arising from this umbilical cord, but this cord is inserting from a distance and this is inserted through a fetal membrane. So this cord is inserted through a membrane and the vessels too. So by this figure you can see here the cord is arising from a distance and this is inserting through a membrane, and vessels are also goes or radiate from this cord till this plate here. So if this type of abnormality is there in a woman and if placenta is low lying, that may cause the vasa previa, because the vessels, this type of vessels which are low lying, comes previously in comparison to the fetal part, and in that condition fetal death may occur, because at the time of labor the membrane become ruptured, and with this rupturing membrane these vessels become also ruptured or torn here, and that may cause decreased blood supply and the finally fetal death. So there may be a chance of separation of this cord with this placenta, because this arises from a distance. So with this cord pulling, there is a chances of cord separation with this main portion of placenta, and if it is low lying then there may be a chances of vasa previa. So this is called the velamentous insertion of cord. So here we have seen the cord abnormality on the basis of the insertion. So normally cord is inserted through the center part or near center, but in battledore, like a bat, it is inserted through a margin. So cord is inserted through a margin, and in the velamentous insertion cord is arising from a distance and these are inserted through a membrane. So these are the variety regarding the insertion of cord. Now the another abnormality of the cord regarding its length. So depending on the length abnormality, there is of two type, that is long cord, because you know the normal length of cord is about 30 to 100 centimeter long, and on an average you can say that is 50 to 60 centimeter long. But if it is too long and it may extend up till 300 centimeter, then it could be a long cord, and that may cause cord entanglement, that is loop around the neck or maybe around the abdomen or maybe around the leg. So as the cord is too long, so it may be wrap around the body part. So as this wrap around the body part, that may delay in the labor process, and it may also cause the cord prolapse, that is cord is coming previously through the vagina and the presenting part remain in the uterine cavity itself. So cord prolapse is one of the danger with this long cord. Sometime with this long cord, true note may be formed, because it is so long and fetal movement may cause real note around the cord, and sometime it may form the false note, that is not the real one, but there is the accumulation of Waters jelly, or there may be a vessels which is kinked or bent over here, and that causes the false perception, that is there is a note over here, but that is the collection of Waters jelly, or maybe the vessel which is kinking over here may cause the perception of the note here, that is called the false note. And the another cord abnormality depending on its length is the short cord. When the length of this cord become too short, that is about 20 centimeter or less than that, so with this type of short cord there may be a chance of abruption, that is premature separation of placenta, because the cord is so short and the fetal movement can cause the pulling of the cord, and that may lead to the placental abruption. And with that there may be a chances of prolonged labor with this short cord, because the presenting part could not be able to descend down and engage, so labor cannot be progressed. So with this short cord, malpresentation also seen, and if you want to correct this malpresentation by the versions, that is the exencephalic version, that will be fail because cord is too short. Now the third variety of the abnormality in the cord is the abnormality on the basis of number of vessels. So usually if you remember, normally in umbilical cord there are 3 vessels, that is 2 artery and 1 vein. So third abnormality is on the basis of number of vessels. So there are 3 vessels, 2 artery and 1 vein. So the abnormality would be single umbilical artery. What is happening here? Usually there are 2 arteries, and if one artery become atrophied, so one will be remain, and if there is only one artery and one vein, then the condition is 2 vessel cord, or you can say that is the single umbilical artery. So this type of condition is very common in the women with the diabetes, or you can say the epileptic women, or if a woman is having oligohydramnios, polyhydramnios. So fetal with the single umbilical artery may have many congenital defects. One more variety is there, that is causes the 4 vessel anomaly. If you remember, I told you previously, usually in embryonic life there are 4 vessels, 2 artery and 2 vein. One vein later on disappears. So that vein, if do not disappear and remain there, that will causes the 4 vessel abnormality. So here in this lecture we have seen the cord abnormalities on the basis of their insertion. Normally cord is inserted from the center or the near center, but if it is inserted through the margin, that is called the battledore placenta, and if the cord is inserted from a distance or it is inserted through a membrane, that is called the velamentous insertion of cord. And depending on the length of the cord, we have seen the long cord and the short cord, and depending on the number of vessels, we have seen the single umbilical artery or the 4 vessel abnormalities. Thank you.